here. For one or two people, this may be a repeat, but nothing is wrong by hearing it for the second time. With that, I'm going to share my screen. Just give me 1 second. I'm going to go to my slides. When I'm going to talk about today, there are a few things I want to say before I start my slides. Okay, there we go. Let me, everybody's able to see it?
Yes.
Yes.
Okay. There are few things that I like to say is, these opinions are mine, and basically I am doing for you to understand what is hypertension and how your body reacts to this, basically the physiology. It's very important to understand your body and your physiology so that whatever measures you take to prevent hypertension is helpful. I cannot give advice or will not be giving advice on any meds. This is because that is a contract between you and your family doctor. They are the only people that you should discuss about your meds. But when you go to the pharmacy to fill your meds, the pharmacist is obligated to talk to you, especially if any of your meds has interaction with the other meds that are prescribed. So this is very, very important. I'm sorry about my dog. The other thing also is having a conversation always helps. So when you go to the pharmacist, say hi, they get to know you and ask about the side effects of the medication and interaction with the other drugs. And you can also get it from Google, but be careful when you Google doctor, because he's a bad guy. He will lead you to the bad places rather than what you're looking for, okay? So next, so the basic physiology, heart is like a filtration pump. If you think of your water system, there's a central pump. Heart is the central pump. The blood from your body returns to the heart by inferior and superior vena cava, flows into the right side. That's why it's blue. It's because it's deoxygenated blood. And from there, it flows to the lungs, to the pulmonary artery. And the lungs is another filtration system in which your carbon dioxide is sent to the air and oxygen is filtered into it. So the oxygenated blood returns to the left side of your heart, and this is another pump. And this pump it pours down to the ventricle. And the ventricle is this portion of your heart, and ventricle pumps the blood back into your body system through the aorta. So the blood pressure is basically the pressure of the ventricle pushing the blood out and hitting the blood vessel. So that is the systolic pressure. The diastolic pressure is when the heart relaxes, the blood from the atrium of the left side flows down to the heart, and that is called the diastolic pressure. So you have two measures in your systems. One is systolic pressure, where the heart pumps the blood into your blood vessels, and the diastolic pressure when the heart is resting. This is measured against the surrounding atmospheric pressure, because the atmosphere and we react. So the pressure is dependent on that. So it's always measured in millimeters of mercury. Now, I admire the system in which we are put together, because every time I do some talk, I marvel at how our system is put together. Whoever did it, whether God or evolution, whichever you believe in, but it is a fantastic system. You have to look after yourself so that the system works for you. Now, if you look at the blood vessel, it's smooth inside, a shiny, shiny coat. That's called tunica interna. And surrounds the lumen where your blood flows through. And then there is an endothelium outside. It's called tunica internal elastic lamina. And there is a little band of tissue going around to keep the blood vessel round. And then there's tunica media, which is a smooth muscle, which dilates and contracts so that your pressure goes up and down, depending upon your systolic and diastolic pressure. The tunica externa is again outside this. It's made up of, again, 2 layers. And this layer is also supplied by blood vessels. So even for your blood vessels, you need supply of blood. So these are the important basic information that one should know, the diastolic pressure and the systolic pressure. Now, when you're born, everybody has a blood pressure. So in babies, the normal pressure is 90 to 60, and the pressure increases through the age. When you reach 20 to 24, the jump is not that much, 2 or 3. And when you reach age 60, this will be your kind of pressure you should normally be, 130 to 187. And the maximum can be little higher, which is 147 to 91. So this is important kind of message for you to know. Please don't get too apprehensive if you have one reading higher, because it doesn't mean anything. It has to be consistently higher. We'll go through that. Now, some people are lucky to have low pressure. When I say lucky, they have other problems with low pressure. We won't go through that. The normal pressure is 120 by 80. And when your pressure skips to 140, this is called pre-hypertension. Your doctor will start monitoring you. Anywhere between 140 to 160, you are called stage 1. And your diastolic pressure, both are important, your diastolic and systolic, 90 to 100. And when it goes above, you're in stage 2 hypertension, and your doctor would explain to you better. And your diastolic pressure also is between 100 to 120. Now, when I say your blood vessels are to be smooth and clean, there are studies showing that even babies die incidentally of various causes. There are plaques already formed in the blood vessel, and these are precursor to narrowing of the blood vessel. What are these plaques? Are basically cholesterol embedded in the blood vessel and narrows the pressure, narrows the vessel so that the heart has to pump harder to go through this narrowed. See how big your cross section is and how narrow it is here. So the heart has to pump harder to push the blood through. So remember I said plaques? These are called plaques. These are cholesterol deposited inside your blood vessel and causes narrowing of your blood vessels. As the time goes on, the cholesterol is being hit by the blood, so you get calcium deposited into them and it becomes brittle and breakable. So, and when they say, people say, oh, I have a narrowing of my coronary arteries, I had to get it dilated. This is what happens. They go in and put in a stent so that this narrowing is not there. So it's very important that we don't allow this narrowing to happen. When this narrowing happens, the blood vessels beyond this, we are in a system of we are in a there is nothing starting and ending of our blood vessels. Everything is connected. So as your blood vessels goes into your capillary, the capillary becomes capillary vein, and the vein becomes a bigger venules, and venules come back to the inferior vena cava or superior vena cava. So the system is not starting and ending. It's like a continuum. So you have to be careful that this doesn't happen, because when the plaque happens, all the micro circulation is affected. That's why some people get problems with blood vessels not being properly opened in your legs. People get leg pain and other things. So this is important to understand. Now, our genes play a major role. The Asian population has two things happening to us. One is we already have very narrow blood vessels, especially in your coronary artery. And the second thing is we have an abnormal gene that causes increase in our cholesterol content. This is being proved by studies by the Heart Institute. So family history of hypertension, age, as we say, age, we increase our age and blood pressure goes up with age, and also gender. I'll be talking about it in a little while. Now, as we can see, this is a graph from the American Heart Association. So this is also true because this is a prevalence study. So in the prevalence study, by 20 to 34 years of age, there's a prevalence of 25.57% of people having hypertension. As you can see, the females are protected all along until they age 55 to 64. Then they catch up with the male, and then they surpass the male when they are age 65 to 75, and then they stay surpassed. Why this is happening? Because here is what the problem is. Your estrogen goes down. Your estrogen keeps your blood pressure under control. When your estrogen goes down because of your menopause, then the protection is removed. You surpass it. So about 15 years ago, they didn't think women had a cardiac stroke, or they do not have incidence of, shall I say, heart attack, but that's being disproven now. So everybody in this age group going to the emergency department with chest pain will be taken seriously. That's the new protocol. So let's go to this slide. When I talk about hypertension, the main part of the hypertension is called primary or essential hypertension. There is no cause for it. Because there is no underlying cost. 90% of them has no underlying cost. But there are problems with what we call as hyposensinogenic factor. One of the factors is obesity and insulin resistance. Insulin resistance is because the fat cells prevents your insulin from getting into your cells, and it causes hypertension. If you study the Inuit population, kids at younger age have no type 2 diabetes. If they have diabetes, it's called type 1 because the pancreas is failing. But the Inuit population has type 2 diabetes, even at the younger age, because they have insulin resistance to because of their obesity and the type of food they eat. This is proven. High alcohol intake is always not good. The thing with hypertension is salt intake. There are certain people who are salt sensitive, and there are people who take a lot more salt than necessary. In the hypertensive, your doctors would have told you, cut down the salt or don't put any added salt, because all your vegetables have their own salt content in them. You do not have to add extra salt to them. An Indian population is addicted to their pickles, including me. They love their pickles. So we have to cut down on it or make your own without too much salt. Aging also we talked about, and the sedentary lifestyle, very, very important. Daily exercise is important. Moving around important. Even when you're watching Zoom, maybe you can do some exercise as you're sitting and watching Zoom. Stress is very, very important. In this COVID time, everybody's stress level is increased. You have to de-stress yourself. Doing meditation, yoga. There are lots of studies, not peer-reviewed studies, that saying people who have hypertension adapting to meditation and yoga have reduced their blood pressure and reduced the need of medication. Low potassium diet is also one cause of hypertension, and low calcium intake. Calcium is the bad guy and the good guy. Now, the next slide, we can see the inherited part is there. We can't do anything about it because we have our genes, which gives you this. But you want to prevent this by hypertensionogenic factor. So if your blood pressure is, say, 110, it pushes you up to about 125 to 129 because of these factors. So if you could reduce your hypertensionogenic factor, like here, if you see, look at stage 1, you're already high, but it pushes you to 170, which is a dangerous level. You don't want to have it. So you should do something to reduce this hypertensionogenic factor. Here is the cause for secondary hypertension. I'm saying this because only 10% of people have secondary hypertension, and they are mainly abnormalities of the blood vessels. People with kidney problems, the filtration system in your kidneys are not working, and there are enzymes in the kidney which pushes your blood pressure up. Sleep apnea, people are getting more and more aware of sleep apnea. This is one of the common things of sudden death. And this is because you forget to breathe when you're sleeping. And this can be diagnosed only if you go through the sleep lab and they put you under the monitor to check it. Tumors of the adrenal gland are very, very rare. Don't even think about it. Hormone abnormality, people with thyroid, only 3% of them get into trouble with hypertension. Mainly the diastolic pressure is pushed up, and this because of the thyroid hormone acting on your vascular resistance, and it increases it, contracts your blood vessels. Hypercholesteremia, we talked about it. As I said, South Asian population do have a complication with hypercholesteremia, and we should cut down on our fat intake. Do thyroid hormone help it? Yes, to some extent it does help. Salt intake, we talked about. I keep repeating this, and alcohol. Please control your alcohol. Over-the-counter medication, people forget that can increase your hypertension. Ibuprofen, Advil, naproxen, Aleve, all this can increase your blood pressure. I'm not saying you cannot take it, moderation. Anabolic steroids, people talked a lot about this because it's banned in the Olympics. Use of anabolic steroids, it causes hypertension. Though it causes increase in your muscle mass, it doesn't protect you. Oral contraceptives with estrogen, very, very important, especially women in the childbearing age with have problems, genes with increasing in your hypertension. This can lead to stroke. That can lead to other problems. So when you go to your doctor, especially if you have a family history of hypertension and you want oral contraceptive, this is for younger generation, of course, they have to be careful. There are drugs like cocaine, because people who are cocaine users can have hypertension and heart attack because of this, because it causes rapid heart rate and narrowing of the vessels. Ephedrine is another substance that are commonly seen in your cold medication. So when you're taking cold medication, over-the-counter cold medication, check with your pharmacist whether that's allowed or not, because everybody says, oh, I have a cold, I'll take a liquid medication. Please be careful when you do that. Coarctation of aorta is a very rare disease you do not have to worry about, but if it's diagnosed, it can be curable. Any of these conditions, you can diagnose early. There is, you can check your symptoms. Now, as I say, positive modifier. In your life, you need positive modifier. I keep repeating again and again, the positive modifier in the hypertension is exercise, healthy diet, weight loss, and antihypertensive diet. These four. This is the normal healthy blood vessel, and see what happens here. When you age, it is narrowed and becomes stiff and becomes not pliable. Now, all these positive modifier work. Exercise works, healthy diet works, weight loss works. The only thing we still don't know is which of the positive modifier applied at what part of your life will do the reverse. Okay, so if you have something on, you're going to the positive modifier, exercise, healthy diet, and weight loss, what is the appropriate time it should be applied? So we know all these works, doesn't mean you shouldn't follow it, but we are still not sure at what part. Once you cross this critical zone, I could see what the positive modifier does. Doesn't bring you back to normal, doesn't do anything. So before you get to the critical zone, it's good to apply the positive modifier. So that's very important. Now, types of hypertension. As I said, there are essential hypertension, but the type one is called resistant hypertension. Drugs, it doesn't come down. That's because it's resistant to the medication. Only 20 to 30% of people with hypertension have a resistant hypertension. That's because of the genes. Older people, female, go to that group, African American, and underlying diabetes or kidney problems. All these are contributory to resistant hypertension. Not everybody gets it. As I said, 20 to 30% of people will shift into this zone. So before you shift there, that's where the positive modifier comes. You have to control yourself. As I said, obesity is the only thing you can control. You can keep your diabetes under control and avoid kidney problems. Isolated hypertension. Long time ago, people used to think, oh, systolic pressure is only high. I don't have to worry about problems. But is high. It can also prevent cardiovascular risk. So you have to control both systolic and diastolic. So say my diastolic is normal, I don't have to worry, it's the wrong information you're giving. Malignant hypertension is very rare, very, very rare, 1%. This happens when your diastolic pressure goes to 130. The common people are young adults, especially African American men, and people would have heard toxemia of pregnancy. This happens when the pregnant woman goes into hypertensive state, and the babies have to be removed from them, because if you want them, the mother to live and the baby to be, even if it's early, can be resuscitated and brought back. So this is very important. It's rare that this happens. So it's very important that the pregnant woman, that's why the frequent checkup and everything happens. This has to be treated only in the hospital. It cannot be treated at doctor's office. If you have any of the symptoms, numbness of the arms and legs, blurred vision, confusion, chest pain, headache, go to the emergency department. Don't go to your doctor's office. It's not that they can't do anything, but they will send you to the emergency department. You don't want that to happen. So as I said, if your blood pressure is high, You have chest pain, headache, shortness of breath, dizziness, you the hospital. You can call your doctor. There's no harm in your doctor to make sure you go to the hospital. Hypertension. When your hypertension is 180 over 120, as I said, it's not one reading. It has to be consistent. If they do one reading, 5 minutes later, repeated, 10 minutes later, repeated. And if it's still hovering over that, you can talk to your doctor and they can change your medication, make one up, one down, add things to your medication so that you bring your pressure down and you don't go into malignant hypertension. So here, your family doctor definitely can help. White coat hypertension. This happens, doesn't matter what age group. I saw in my pediatric age group, as soon as they come into the doctor's office and they see the white coat, that's why I never wore a white coat when I was working, the blood pressure will go up. And the only way you do it is repeated blood pressure, because the nurse at triage diagnoses the normal pressure and you go there and the pressure is high, wait for some time, have a nice conversation and redo it. It happens with the adults too, especially if you are very stressed, you're very nervous, and you already come with a preconceived idea from Dr. Google, everything will be going up. So as I said, one reading is not enough, but you have to be careful about the cardiovascular risk. Now, people say, why should I show this slide? Everybody knows to take blood pressure. Wrong. I would like you to watch this. Ah. Why is it not playing? Are you able to see it?
Yeah, we can see it.
Yes.
Yeah.
Okay.
There's no sound. I don't know if originally there is no sound or.
Okay, let me just go to my screen.
It's okay now. Now we have a sound. Yeah.
Okay.
Okay.
Aim to take your blood pressure at the same time each day. Just sit comfortably in a chair that supports your back and have a desk or a table in front of you. Keep your feet flat on the floor and don't cross your legs. Make sure you're wearing something loose enough to allow you to uncover your upper arm and that isn't too tight. Then take 5 minutes to sit and relax. Then rest your arm on the table so your forearm is about level with your heart. Stretch your arm out with the palm facing upwards. Then put on the blood pressure cuff with the bottom 1 inch above your elbow. The tubing or arrow mark should be in the centre of the front of your arm. Now tighten the cuff so you can just fit in 2 fingertips. And make sure it is evenly tight at the top and the bottom. Now press start on the machine. Sit still and don't talk while the machine is working. You will feel the cuff inflate and deflate. Then write your measurements down with the date and the time. Wait a couple of minutes and take another measurement. If you find there's a big difference, wait a few more minutes and do it again.
Okay, so I'm going back to my slide. So it's essential that you do your blood pressure when you're calm. Sometimes you say, oh, I'm having a little bit of dizziness, my blood pressure must be high. You go and take it, it will definitely be high. Please don't get perturbed by it. Just relax, do it again. So that's the important message I would like to say. The fifth conception is, oh, my blood pressure is not high. It's not a big deal. I can reverse the problem. No, you work with your family physician. Change your diet. It's a silent killer. Like diabetes, it is very silent because as the pressure increases or adds up, changes happen. Remember I said the positive modifier don't work after you pass certain stage. So you want to do it early. Healthy diet. We'll talk about the diet a little bit. Limiting your salt and processed food. Smoking tobacco, minimizing secondary exposure, not smoking tobacco, not smoking. Minimize your pressure. Daily activity, 30 minutes of activity, at least 5 days a week. And weight control. Make sure you have less stress. Sometimes talking your problem with somebody can help you to bring down your stress level and your heart is not beating too fast and not tightening up. Now, the salt intake, this is very, very important. This is what Health Canada says. 1,500 milligrams of salt a day, not to exceed 23 milligrams of salt, which is equivalent to 1 teaspoon, which is not a big amount. You have to follow kind of this restriction if you already have hypertension. What are the products that it really does it in? Bakery products are very high in salt. Mixed dishes, if you're mixing several dishes, it's tasty to, it's very salty. Processed meat, cheese is very high in salt. You could buy cheese which are low sodium. They are available. Commercial soups are very salty. Any dips, gravies, condiments that come commercially have high salt content. Fat oil spreads and dressing like mayonnaise and what else is there? Oh, your salad dressings that you buy commercially. You could buy low salt dressing, but they all will have, if one content is reduced, they increase the other content. So make your own salad dressing. Snack foods like all the papads and mixtures and whatever is available, very high in salt. They have to do that so that it's stable for a longer period of time. Fish, sea products, they are high in salt because they come from the sea. Breakfast cereal, you will be amazed. Check your salt content in your breakfast cereal. How much of salt is added to your breakfast cereal? And processed vegetables and juices, V8, just check the salt content in your V8. Now they have introduced low salt V8, butter and nuts. So there is natural salt in all these, and but you don't want to increase it more. So this is just a rough thing to say what foods you can check. Third misconception is, oh, one number is wrong. Okay, second number is high, doesn't matter. Not really. Both the numbers matter. Check with your doctor. Okay, so when you do your blood pressure, don't get too worried. Check with your doctor. Now, if you're kind of obese person, the standard blood pressure cuff will not fit you. You may need a specialized cuff because it has to cover 2/3 of the bladder or the thing in it to increase the pressure. Should cover 2/3 of your arm. So you may have to buy a different blood pressure cuff to take the blood pressure. Fourth, diet control alone is okay. Yes, it's okay, but add with medication. Each person is an individual. What works for one will not work for another. So, control with the medication. So my doctor put a patient, use it for a month to see whether it's working or not. and then talk to your doctor and they will change it or add a medication. So it's a slow process. You're not going to get immediate effect from your medication. And also it's not good. You have to bring your pressure down slowly because your body is used to this pressure. So when you bring the pressure down, you have to bring it down slowly. And the last misconception is your treatment plan, as I said, with your family physician is not working, your diet is not working. So what? I'm only going to live for so long, so doesn't matter. That's the wrong attitude, because as long as you live, you want to live healthy and keep yourself healthy so that you're not causing problems to others around you. When you're in trouble, seek help, understand your medication, take care of your side effects, and talk with the dietitian so that they can prescribe an appropriate diet. People say, oh, I'm a vegetarian. They don't know what to say. Even I had the misconception, but all the dietitians are pretty good. They would help you with your vegetarian diet. Now, this is called DASH diet, which helps to bring down your pressure. Common things: beetroot for non-vegetarian people. You can use chicken. All grains, all fruits are very good. Garlic is good. Onions are good. Bananas are good. Say, oh, potassium will go up. Maybe. Just check with your family doctor. Cocoa is very good, and potatoes. So this is basic. This is what we eat. So you could just alter your diet. The DASH diet is dietary approach to stop hypertension. That's called DASH. Eating less fat, especially saturated fat. What are saturated fat? Ghee is saturated fat. If you look at the oil, certain oils are saturated. You could buy fat low in saturated fat. You just have to do some investigation and planning. The whole grain is very good. That's why we are going back to eating whole grain food. When you're using wheat, use your whole wheat to make your chapatis. When you're eating cereal, go back to your whole grain cereal. So there are accommodations you can eat. So look at these vegetables. Every one of them will help you to reduce your blood pressure. Just don't add salt to it. Complications of hypertension, there are several. First complication is neurology, which is stroke, dementia problem, because when your blood vessels keep blocking and not flowing, it could lead to stroke, and also constant death of your brain cells would lead to dementia. Retinopathy, that's why diabetic people with hypertension must follow, I think the rule is every 6 months with your ophthalmologist, because they check your back of your retina. You don't want to have a retinal detachment because there's bleeding and it pulls the retina away from back. You don't want to have bleeding blood vessels. People do laser surgeries to coagulate the blood vessels that are bleeding. Confusion and headache. Convulsions. When your pressure goes up very high, you can get into convulsions. That's why this is a very dangerous sign. And atherosclerosis, we talked about it. Aneurysm is one side is blocked and the blood is trying to push it. The side that is or normal gets dilated, and that's called aneurysm, because this is narrowed and blocked and the blood vessel trying to push it so that the flows into the other, and that's called aneurysmal dilatation. Your kidneys, diabetic have problem. That's why diabetes is also a silent killer. Prolonged diabetes will lead you to kidney problem, and hypertension is a result of it. They go hand in hand. So your glomeruli is not filtering all the bad stuff out of your blood, and your blood pressure goes up because there is a substance called renin that increases your blood pressure. Heart attack, we talked about that, how the blood vessels, your coronary arteries. People with Asian subgroup have very narrow coronary arteries, and then having a plaque formation in them increases your chance of having a heart attack. So be mindful of that. When I say about your bleeding, this is called flame hemorrhages. And this is what your ophthalmologists don't want to see. They go and coagulate it with a laser so that the retina, which is like a little sheet attached to the back of the eyeball, doesn't separate from the eyeball. And you have cotton wool spots. These are all kind of dead tissue. And this is called macula. And here you see, you don't even see that. That's why people with hypertension and diabetes have tunnel vision, what is called tunnel vision. They can only see straight. The side visions are blocked. So I said I want to talk about medication. These are generally the type of medication used. So it may differ for people to people, but the common medication used in diabetes is diuretics. So which makes you go to the bathroom more, pee. When you pee your extra sodium and your extra fluid. So you don't accumulate fluid in your body. So extras and when you go to the wash to pee, all the sodium also runs off the pee. So diuretics are used to control blood pressure. ACE inhibitors, which act on remember I said the enzyme renin that is produced in the kidney, which increases your blood pressure. ACE inhibitors are used. Alpha blockers are not common, but they can be used if you have problems with norepinephrine, which is one of the things that's produced by your adrenal gland. The common medication is calcium channel blockers that are used. This prevents your blood vessel from tightening, becoming stiff. Beta blockers are commonly used, and that works on the adrenaline, which is a stress hormone, and reduces your stress level and reduces your blood pressure and reduces the tightening. So common things are diuretics and beta blockers and calcium channel blockers. They all have side effects. So discuss with your family doctor through the medication. So I hope I have told you what blood pressure is, how to prevent it, and how to apply your own knowledge to prevent complications of hypertension. Thank you very much.
Okay.
I will stop sharing.
Great. Thank you, Chandraji. Thank you.
Thank you. So if anybody has any questions, raise your hand, please. Did you say that?
Now, raise your hand, please. Don't unmute yourself. You please unmute when Sudesh calls you, invites you, right? Raise your hand digitally, not physically.
Anji, Kapil ji, go ahead, ask your question.
Ani, I have two questions. I know the presentation is about hypertension. Is the low blood pressure ever an issue?
Yes.
And the second question is, when you say too much alcohol, what is the definition of normal alcohol? Thank you.
That's a tough question for me to answer. Yes, low blood pressure people do have problems with dizziness, especially postural dizziness. They suddenly get up from lying down position, they can become very dizzy and almost have a fainting because the blood pressure is not, the blood is not going to the brain. That is the problem there, but they get to navigate their problem by just understanding their body physiology. The second question is, what is good alcohol? I don't know. Everybody is different. People say, I have a nightcap every day. Maybe it's okay. But if you have 4 or 5 nightcaps, it's bad.
Or you have a glass of wine with dinner, is that too much or?
No, it's okay, because there are people, you hear every time, oh, red wine is good for your heart. So glass of wine, they say it's okay. I'm a teetotaler, so I cannot answer that question for you. But there are people who say that's okay, as long as you don't overdo it.
Okay, thank you.
Next question from Praveer ji. Unmute kar lena pehle.
Excellent presentation, Chandra ji. I hope as normal you'll circulate the slides. I have two related questions. Many of the risk factors for hypertension and diabetes seem to be in common. Is there a very strong correlation between people who have type 2 diabetes and people who have hypertension, somebody like myself? And the related question is, are we people from India more prone to hypertension because of our diet?
Okay, I will talk.
Diet and genetic factors.
Yes, the people with diabetes have problems because what happens is the sugar
Insulin
in your
resistance.
system also causes problems with your filtration. So over the period of time, your little glomeruli, little bunch of blood vessels filtering your bad stuff off your kidney, off your blood vessel, gets destroyed. When that gets destroyed, the enzyme called renin increases because the salt is increasing and it wants to get the content salt down, so it causes blood pressure. So the diabetes could be the onset. The secondary part of it is the increase in the pressure is because of the renin and what's happening to your kidney. That's why diabetes is called a silent killer, and the hypertension going with it is called a silent killer. The end-stage renal disease, the culprit, what they call for the end-stage renal disease, is diabetes and hypertension. Now, diet-wise, why Indians? We are basically people who eat a lot of carbohydrates, and technically we have become more sedentary in our lifestyle. People are not exercising. You find, you go to India, I don't know, when I go to Chennai, there's no playground for children. They build more and more schools because of the population, and every block in the school system is used up for building classrooms. They don't give importance to sports. They don't give importance to activity. When I was growing up, we had a period called physical exercise. You cannot skip your physical exercise. That's not there now. Now their physical exercises, they carry their books. That's physical exercise. They have to change the attitude. And of course, our genes plays an important part, as we told. We do have genes that causes, and we do have narrowing of our coronary arteries. Those two together make us more and more prone for hypertension and cardiac problems.
But there is a very simple additional reason. When I was growing up, junk foods were very rare and costly. I couldn't buy a bag of chips or a hamburger or a French fries or so on. And kids now seem to be enjoying junk food all over the place.
I should tell you a story. I was visiting one of the theaters in India. So this dad and the kid came in. So he bought Coca-Cola, this bigger size. And a few minutes later, he chucked it and he said, I want French fries. So everything is supersized, that much. A few minutes later, he would chuck that and say, I want hamburger. Yes, these people are affluent people. They're not thinking about what will it do to the kid in the future. But they just want to shut the kid up so that he'd stop bugging them. That's not the way to go. You know, as a parent, you have certain set of rules that you need to follow, because you are setting standards at the young age so that they don't grow into adults wanting and eating everything in front of you. As you can see, what you eat. That's the problem with us, is the junk food, because you can go to Costco or Walmart and buy things for $1. dollars, nothing. You buy it and it's very high in salt, very high in fat.
So next question from Stinder Channi. Please go ahead.
I just wanted to know what is the level at which one knows that one is obese? What is
your BMI? When they do, there's a graph, your height and weight is tabulated, and then you get your BMI. If I'm right, your BMI are less than 27 or 28 is okay. If you're over 29, there is problem. And then if you're 30 or 35, you go into very obese problem.
Right.
So it's the BMI that is important. Because now if you go to all the sports centers, your weighing machine will automatically give you the BMI.
Okay.
Thank you.
Next question from Subhash Malhotra.
Yeah, thanks. It was a very informative. But my question is, can you refer to your bar chart, what you are showing in your presentation? In the bar chart, one side of the axis was the different items, I mean bakery and chips and all that. And other side, if I could read properly, it was shown in the percentage. Very surprisingly, the bakery was the number one, showing 20%, while this chips, salty chips was hardly 2%. Does this percentage represent the weight percent? And if I go by the weight to chips, if hardly 10 gram or 15 grams, even or that contains hardly 2%, while bakery item containing 20%. I'm little bit confused. If you can throw little light.
I will go to my chart.
Yeah.
Can you see my chart?
No, still no.
Okay, I have to share the screen. 1 second.
You got my question, no?
Yeah, I'll share the screen. Okay, now I go to this. Okay, the bakery food, as you see, has the highest salt content.
Yeah, 20% or almost.
Yes. Then comes the mixed dishes. And the last is, which one are you questioning?
Yeah,
the
okay.
Chips, huh?
So the chips was around 2%, you can see, or 3% salty chips.
Processed vegetables.
Yeah.
Sauce, dips, and gravies.
Snack food.
Yeah. They're salty snack foods, but they are less than. So if you add, suppose you are buying tacos and you add cheese to it and you add
very
gravy to it, it's high, very, very high in salt.
Yeah. What I mean to say, this percentage what you have given as a 20% and 2% or 3% might be snacks foods. Is it by the weight percent or what it is? Because
that I don't know. This is published by the Canadian dietary system.
Because I'm confused on the reason that if I go by the weight percent, the bakery item mostly weighs whatever we eat, it might be 20 gram or might be 50 grams, while the snacks food, which contains hardly 2% against 20%, we eat hardly 5 gram or 10 grams and all that. So it's just nothing in comparison to that. It means,
but if you look at your daily requirement,
no, I'm just talking of the chart only, nothing else.
This is just giving you a rough thing saying which foods to avoid. And when you're buying bakery foods, it's just to get you to read the label. So that.
Thank you. I got it now. It's basically.
We see a portion that you eat.
Yes,
more
the
of
portion.
Bakery stuff than you would for your snack.
Like if you buy macaroni and cheese, it's very high in salt. That's because
bakeries are the highest at the 20%.
This is it. The bakeries are the highest.
Anyway, I got your answer. Thank you.
Yes, thank you.
Okay, next, Deep. Deep Parar, please go ahead.
Yeah. I wanted to find out that diastolic, if it's low, like I said, it's supposed to be ideally at 80. how low can it go? And what does it mean when, say, if it's below 60?
Your systolic pressure?
Diastolic.
Hello?
Hi. Is your systolic or diastolic pressure?
Diastolic.
Diastolic.
Diastolic. If it
okay.
goes below.
If it's low.
How low? Yeah.
How low it is to go? I'm just going to go again, share my screen.
It didn't have in it.
You're able to see my chart?
Yep.
Okay. So if our age group, let's say we are all about 60. So the minimum pressure here, your diastolic should be about 80. 83 or 80, doesn't matter. And your systolic should be there. That's the minimum you should have. But if you look at the maximum, your diastolic pressure can be 91 and your systolic pressure can be 147. See, this is the population study. And
but what is below 80?
Yeah. So normally it can be below 80. So some people do have low diastolic pressure, but as long as it doesn't affect you, everything is, if you don't have any symptoms, you don't have any problem, it's okay. Your body is saying, I am norm with this. So you don't have to worry. But if you have problems, then you have to discuss with your doctor.
Okay, thank you.
Right, next, Nandji, go ahead, Nandandan.
Chandraji, you are a great demonstration of what a combination of good knowledge and great teaching skills can do. Thank you very much.
Thank you.
I
should thank the Indian program. You know, my basic study was in Tanjore Medical College. We had 2 years of anatomy and physiology.
Okay. I have 2 questions, Chandraji. One is occasionally, not regularly, say once in a while, you get up in the morning and you feel a bit of off balance for momentarily, and then you're okay. Is that does that have something to do with blood pressure changing while you're sleeping and that kind of thing?
Yes, yeah. When you reach certain age, you are told not to move fast. So when you're lying down, your pressures are different in accordance with the atmospheric pressure. So when you change or alter position and you do it too fast, it affects you because your brain is not getting the flow it needs. So that's why you feel kind of dizzy. So you're supposed to sit, take a couple of seconds, and then stand. So you're, when you go to your even exercise class, they tell you, you don't move too fast, because that's very important. Is to, sometimes if you're doing it too fast and you're older adult, you may even fall. So it's one of the causes of fall.
Also, your blood pressure medications can give you lower blood pressure, postural hypertension.
Yes, that's called postural hypertension. Yes, hypotension, sorry.
Yeah.
My second question is, can you do something to satisfy your salt craving? Like, is there a sort of substitute of salt, like sea salt, or are they all equally bad, or is there some kind of a gradation there?
I'm sorry to say all are bad. There are potassium supplements, salt with the potassium instead of sodium in them. People have tried it. I haven't tried sodium supplemented salt. Potassium supplemented salt. They are available in the health food store. I don't know. You may have to discuss with your dietitian. I think they may still advise it if you have real problems with your hypertension. But
I don't have a
technically it
problem.
says remove your salt shaker, remove your salt from your cooking.
That won't remove the craving. I don't have hypertension, but I have a salt craving.
I do. I don't eat sweet food, but I love salty food.
How's the blood pressure, Chandra?
Normal.
Good.
They say the reason for that is in your evolution, you grew from the sea. So if you look at the salt in your blood, your sodium is 135 millimoles per liter. So the sea is there in you. So you attract more salt. This is one of the explanations by their naturalist or whatever you call, because you came out of the sea, your organisms, that's why you like to keep salt in your system. I may be wrong.
Thank you.
Thank you, Chandraji. It's a great presentation. I think we all learned something from it. And we'll have you back another time for a different subject.
Thank you. Thank you very much. Much enjoyed.
Ganga.
I learn every time I present too.
Okay. Ganga, Suman Mahajan, I think they got